Do your joints feel stiff every morning? Is bending, walking, or even getting out of bed becoming more difficult as the years go by? You're not alone, and you don't have to live with that pain forever. Today, we're diving into the top supplements proven to help relieve joint pain, reduce inflammation, and give you back your freedom of movement, especially if you're over 60. And here's the best part. They're natural, safe, and actually backed by science. After the age of 60, your joints undergo a lot of wear and tear. Cartilage thins, lubrication decreases, inflammation rises, and conditions like osteoarthritis become far more common. But joint pain isn't just about discomfort. It impacts your independence, your sleep, your ability to stay active, and ultimately, your quality of life. Many people turn to over-the-counter painkillers like ibuprofen or prescription anti-inflammatories. But long-term use of these medications can cause serious side effects like stomach ulcers, kidney damage, and increased heart risk. That's why more and more seniors are looking for natural alternatives that don't just mask pain, but help heal the underlying issues. Today, we'll explore the best evidence-based supplements to support joint health after 60, so you can walk, bend, and move without fear. Let's begin with the most famous one, glucosamine and chondroitin. Let's start with two of the most well-known joint supplements, glucosamine and chondroitin. You've probably seen them on store shelves or in commercials, but what do they really do? What they are. Glucosamine is a natural compound found in cartilage, the tough tissue that cushions joints. Chondroitin is another essential substance found in connective tissues. It helps cartilage retain water and maintain elasticity. Together, they've been used for decades to treat joint pain, especially from osteoarthritis, the most common type of arthritis in older adults. How they help. Several studies have shown that this combo can slow cartilage breakdown, reduce joint stiffness, improve mobility, and in some cases, reduce the need for NSAIDs. One major study published in the New England Journal of Medicine found that glucosamine and chondroitin significantly reduced moderate to severe knee pain in people with osteoarthritis. What's more, it doesn't just treat symptoms. There's evidence that it can actually support cartilage regeneration over time, especially when taken consistently. How to take it. Typical dosage is 1,500 milligrams of glucosamine and 1,200 milligrams of chondroitin daily, often split into 2 doses. Look for sulfate forms, as these are more effective than hydrochloride versions. And be patient. It can take 4 to 8 weeks before you feel noticeable improvements. A quick caution. If you have a shellfish allergy, check the label. Many glucosamine supplements are derived from shellfish. Luckily, there are vegan options available now. Also, always talk to your doctor if you're on blood thinners, as chondroitin might increase bleeding risk slightly when combined with certain medications. Why it's still worth trying. Even though it's been around for years, this duo remains a go-to for joint health. It's safe for long-term use, affordable, and most importantly, many seniors swear by it. Up next, let's look at a powerful natural anti-inflammatory that comes straight from your spice cabinet, but works like a painkiller, turmeric curcumin. Let's talk about a bright yellow spice that's been used for centuries in Indian and Asian medicine, turmeric. But the real star here is curcumin, the active compound inside turmeric that delivers most of the anti-inflammatory benefits. What makes curcumin so special? Chronic joint pain, whether from arthritis or general wear and tear, is largely driven by inflammation. And curcumin is one of the most potent natural anti-inflammatories ever studied. In fact, Some research shows it can work as well as certain prescription drugs, without the risky side effects. One clinical trial published in Phytotherapy Research found that curcumin was just as effective as ibuprofen in reducing pain among people with knee osteoarthritis, and with far fewer digestive complaints. It works by blocking molecules like NF-κB, which trigger inflammation in the body. This can lead to reduced swelling, less joint stiffness, and improved mobility over time. How much do you need? The typical therapeutic dose ranges from 500 to 2,000 milligrams of curcumin per day. But here's the catch. Curcumin is poorly absorbed on its own. That's why it's important to choose a supplement that includes black pepper extract, often labeled as bioperine, which can enhance absorption by up to 2,000%. What to look for? A high-potency extract with 95% standardized curcuminoids. Black pepper extract or liposomal formulations for better bioavailability. Third-party tested brands with good reviews, since supplements are not FDA-regulated like medications. Who should consider it? Turmeric is particularly useful if your joint pain is accompanied by swelling, heat, or stiffness, and especially if you prefer to avoid NSAIDs due to gastrointestinal or heart concerns. It's also great for overall inflammation control, not just in joints but throughout the body, which is why some people report benefits in mood, brain function, and even digestion. Quick tip: start low, maybe 500 milligrams per day, and increase slowly. Some people experience mild nausea or diarrhea with high doses at first. Always take it with food to minimize any stomach irritation. Coming up next, a supplement that doesn't just reduce inflammation, it actually supports your body's collagen production, which is key for keeping joints strong and flexible. Let's talk about collagen peptides. As we age, one of the most overlooked reasons for joint pain is the natural decline of collagen in our bodies. Collagen is a structural protein. It's what gives our joints, tendons, and ligaments their strength and flexibility. After the age of 50, our collagen production drops significantly, which can make joints feel stiff, achy, and less resilient. That's where collagen peptides come in. Why collagen matters. Collagen isn't just for your skin. It's vital for joint health. Type 2 collagen, in particular, is the main form found in cartilage. Supplementing with collagen peptides has been shown to improve joint comfort and mobility, support cartilage regeneration, reduce joint stiffness, help protect against further wear and tear. A 24-week study published in the journal Current Medical Research and Opinion found that athletes who took collagen peptides daily experienced significant improvements in joint pain during physical activity, even compared to a placebo. How it works. When you take collagen peptides, also called hydrolyzed collagen, your body breaks them down into amino acids that are then used to rebuild joint tissue and stimulate new collagen formation. How to use. Aim for 10 to 15 grams daily, usually mixed into water, smoothies, or coffee. Look for grass-fed, pasture-raised sources with no added sugars or fillers. Some formulas include vitamin C, which helps boost collagen synthesis, so that's a bonus. What to expect. You won't feel results overnight. It usually takes about 6 to 8 weeks of consistent use to start noticing less pain and better flexibility. But when combined with other joint supportive habits like stretching, hydration, and gentle movement, it can make a lasting difference. Collagen is safe, well-tolerated, and easy to incorporate into your morning routine. Next, we'll explore a lesser-known mineral that's absolutely essential for joint repair and inflammation control, boron. If you've never heard of boron before, you're not alone. It's a trace mineral that doesn't get much attention, but it plays a crucial role in bone strength, inflammation regulation, and joint repair, especially in older adults. Why boron matters. Research shows that boron helps the body retain calcium and magnesium, both essential for maintaining healthy bones and joint tissue. It also has a powerful impact on hormonal balance, particularly in regulating levels of estrogen and testosterone, which decline with age and can affect bone and joint health. But here's where boron really shines. It reduces inflammatory biomarkers like CRP, C-reactive protein, and boosts vitamin D utilization, making it a perfect partner for any joint health regimen. In fact, studies from regions with high natural boron intake, like parts of Israel and Australia, report lower rates of arthritis compared to areas where dietary boron is scarce. What the science says. A double-blind study published in Environmental Health Perspectives found that people with osteoarthritis who supplemented with 6 milligrams of boron daily experienced substantial improvement in pain and mobility within just 8 weeks. Boron is believed to help stabilize cell membranes and regulate enzyme activity in the joint space, which may slow cartilage degradation and reduce joint inflammation. How much do you need? The therapeutic dose typically ranges from 3 milligrams to 6 milligrams per day. It's naturally found in foods like prunes, raisins, almonds, and avocados, but it can be hard to get enough from diet alone, especially as nutrient density in modern produce declines. Choosing a supplement. Look for boron glycinate or citrate for better absorption. It's often included in bone health or joint formulas alongside magnesium, zinc, or vitamin D. Also, be cautious not to exceed 10 milligrams per day unless under medical supervision. More isn't always better, and too much can stress the kidneys. Bottom line, boron may not be as flashy as turmeric or fish oil, but it works quietly in the background to strengthen bones, calm inflammation, and support your body's natural repair processes. It's especially valuable for postmenopausal women and anyone at risk for osteoporosis or osteoarthritis. Ready to support your joints from within? Then it's time to consider one of the most well-researched supplements in the world, omega-3 fatty acids. Let's dive into the powerful effects of fish oil. If there's one supplement that truly deserves the title of a joint health superstar, it's omega-3 fatty acids, particularly those found in fish oil. EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These healthy fats don't just support the heart and brain. They're also among the most effective natural anti-inflammatory agents for sore, aching joints. Why omega-3s are crucial for joint health. Joint pain, stiffness, and swelling are all linked to inflammation, and chronic inflammation is what causes cartilage breakdown over time. That's why omega-3s are so important. They help turn down the inflammatory response in the body. EPA and DHA reduce the production of pro-inflammatory cytokines, such as IL-1 and TNF-alpha, and promote the release of resolvins and protectins, which actively help the body resolve inflammation. In simpler terms, they help cool the internal fire that's damaging your joints. Real-world benefits backed by research. Several clinical trials have found that omega-3 supplements can decrease morning stiffness, reduce joint tenderness and swelling, lower the need for NSAIDs, nonsteroidal anti-inflammatory drugs, improve grip strength and mobility. One notable study published in Rheumatology found that over 60% of patients with rheumatoid arthritis who supplemented with omega-3s were able to reduce or eliminate their reliance on NSAIDs after just 3 months. Another meta-analysis from the Global Journal of Health Science concluded that fish oil supplementation provided significant relief from joint pain and improved joint function, especially in older adults. How much do you need? For therapeutic joint support, most experts recommend 1,000 to 2,000 milligrams of combined EPA and DHA daily. That usually means about 2 to 4 soft gels, depending on the brand. Be sure to read the label closely. Some products only contain 300 milligrams per capsule, while higher quality brands may pack 1,000 milligrams or more per soft gel. Also, choose triglyceride form omega-3s when possible. They're better absorbed than the cheaper ethyl ester forms. What about krill oil? Krill oil is another omega-3 source that's gaining popularity. It contains EPA and DHA in phospholipid form, which may be more bioavailable. And it also has astaxanthin, a powerful antioxidant that adds joint protection. However, krill oil tends to be more expensive and lower in total EPA/DHA content than high-quality fish oil. It's still a good option, just be mindful of the dosage. Side effects and safety. Omega-3s are generally safe, even at higher doses. The most common side effects are mild digestive upset or a fishy aftertaste, which can be minimized by taking them with food, choosing enteric-coated capsules, refrigerating your bottle to reduce oxidation and odor. If you're on blood thinners or preparing for surgery, talk to your doctor, as omega-3s can slightly increase bleeding time at very high doses. Vegetarian options. Don't eat fish? No problem. Algal oil from marine algae is a plant-based omega-3 supplement that provides pure DHA, sometimes with a little EPA. It's perfect for vegetarians, vegans, or anyone with seafood allergies. Combine omega-3s with the right lifestyle. While omega-3s work wonders on their own, their impact multiplies when combined with an anti-inflammatory diet, gentle movement like Tai Chi or swimming, and consistent hydration. Think of them as one piece in a larger puzzle of joint protection. In summary, omega-3s offer long-term relief from joint pain, not just by masking symptoms, but by targeting the root cause, inflammation. They support flexibility, reduce stiffness, and help preserve the integrity of your cartilage. So whether you're managing arthritis, recovering from injury, or simply hoping to stay mobile well into your 70s and beyond, omega-3s are a smart, science-backed addition to your supplement stack. Up next, let's uncover the anti-inflammatory spice that's been used for centuries and is now backed by modern science, turmeric. Few natural remedies have received as much attention in recent years as turmeric, and for good reason. This bright golden spice, long used in Ayurvedic and Asian medicine, contains an active compound called curcumin, a potent anti-inflammatory and antioxidant that offers real relief for aching joints. Curcumin works by inhibiting NF-κB, a molecule that travels into the nuclei of your cells and turns on genes related to inflammation. By blocking this pathway, curcumin slows down the body's inflammatory response, which is especially valuable in chronic joint conditions like osteoarthritis or rheumatoid arthritis. Studies have shown that curcumin can be as effective as ibuprofen in reducing joint pain, without the harsh gastrointestinal side effects. In fact, a 2014 study published in Clinical Interventions in Aging found that patients taking 1,000 milligrams of curcumin daily experienced similar reductions in pain and stiffness as those on NSAIDs. But here's the catch. Curcumin is poorly absorbed on its own. That's why it's essential to look for supplements that contain piperine, black pepper extract, which boosts curcumin absorption by up to 2,000%. Some formulas also include liposomal or micellar delivery systems to improve bioavailability. If you're aiming for better mobility, reduced swelling, and a natural approach to pain relief, curcumin is a safe, well-studied option and an excellent ally in your joint support toolkit. Next up, let's look at one of the most overlooked vitamins for joint recovery, vitamin K2. When we talk about supplements for joint pain, vitamin K2 often gets overlooked, but it plays a critical role in maintaining both joint flexibility and bone strength, especially as we age. So what exactly does K2 do? Vitamin K2 activates proteins that help direct calcium to the right places, namely your bones and teeth, and keep it out of soft tissues like arteries and joints. Without enough K2, calcium can start to accumulate in your cartilage and joint linings, leading to stiffness, reduced mobility, and even pain. That's why K2 isn't just a bone vitamin, it's a joint protector, ensuring that minerals are used where they're needed and not where they'll cause damage. The synergy with vitamin D3. K2 works best in combination with vitamin D3. While D3 helps your body absorb calcium, K2 ensures that calcium goes where it belongs. Without enough K2, high-dose D3 supplementation can unintentionally contribute to calcium buildup in joints and arteries, a condition known as vascular or soft tissue calcification. Together, D3 plus K2 form a powerhouse team for stronger bones, healthier joints, and smoother mobility. Best forms and dosage. The most effective form is -7 Malawian kwaches, a long-chain version of K2 that stays active in the body for over 48 hours. Look for supplements offering 100 to 200 micrograms of -7 Malawian kwaches daily. Foods like natto, fermented soybeans, some cheeses, and egg yolks contain small amounts of K2, but supplementation is often necessary, especially in Western diets that lack fermented foods. The bottom line: if you're over 60, and especially if you're already taking calcium or D3, adding vitamin K2 to your supplement routine is a smart move. It helps prevent joint calcification, maintains bone flexibility, and may reduce the risk of osteoarthritis progression over time. Next, we'll explore a lesser-known mineral that supports cartilage repair and combats joint inflammation: boron. Boron might not be as famous as calcium or magnesium, but this trace mineral plays a powerful role in keeping your joints healthy, especially as you age. How does it help? Boron supports the metabolism of key joint-supporting nutrients, including calcium, magnesium, and vitamin D. But its real magic lies in its ability to reduce inflammatory markers, such as CRP, C-reactive protein, which are often elevated in people with joint pain or arthritis. Even better, boron helps the body retain estrogen and testosterone, two hormones that naturally decline with age and are vital for joint and bone integrity. In one study, individuals with arthritis who took 6 milligrams of boron daily reported significant reductions in pain and stiffness. Some even saw symptoms completely disappear. While small amounts can be found in fruits, nuts, and leafy greens, most people over 60 benefit from a daily supplement of 3 to 6 milligrams of boron. It's a small dose for a big difference. Next, let's look at a cutting-edge supplement that's changing how we think about cartilage regeneration: collagen peptides. As we age, our body's natural production of collagen, the protein that forms the foundation of our joints, cartilage, and connective tissue, begins to decline. By age 60, we're producing far less than we need to maintain joint flexibility and resilience. That's where collagen peptides come in. These hydrolyzed forms of collagen are easily absorbed and used by the body to repair joint tissues, restore cartilage, and reduce inflammation. Multiple clinical studies have shown that supplementing with 10 grams of collagen peptides daily can significantly improve joint comfort and mobility, particularly in people with osteoarthritis. In one 24-week study, older adults who took collagen peptides reported less joint stiffness, better range of motion, and even improved recovery after physical activity. To get the best results, look for type 2 collagen or multi-type blends, and consider formulas that also include vitamin C, which boosts collagen synthesis.